Okay, so Niemann-Pick disease families actually fall into two distinct groups. So there is Niemann-Pick disease type C, which is a neurodegenerative metabolic disorder. Those children are diagnosed anywhere from infancy to childhood and progressively lose motor function and cognitive impairment. So it's been described by some as a childhood Alzheimer's, in terms of they lose memory, attention, they have a lot of learning difficulties, but they also develop impairments in ability to move around. Many progress to needing feeding tubes, and it's very variable in terms of lifespan. So we have some children that pass away very early and some that live on into adulthood but with significant impairments. The other branch of Niemann-Pick disease is called acid Sphingomyelinase deficiency, ASMD. Those children have a spectrum of disease ranging from a very early infantile onset with severe neurological disease right on through children who live on into adulthood but with impairment in liver, lung, and spleen function that impacts their endurance, their mobility, their activity tolerance, makes them very prone to chest infections, those kinds of issues. Our foundation can help in terms of helping them link with resources, in terms of community resources, as well as physician and clinical expertise centers, in terms of being able to link with centers of excellence. We can also help with helping them link with other families and a support network for dealing with living with the disease process. We also are able to provide information on clinical trials. So we have clinical trials up and running for Niemann-Pick type C. We have a clinical trial running based out of NIH in a multi-site trial. There is also another trial for adults with Niemann-Pick type C, and there is a trial underway sponsored by Genzyme for ASMD type B.